We'll give a few minutes, everyone. I see Dr. Pastor's in, so then we'll get started. Please keep your phone or computer muted so that we can hear Dr. Pastor speak. So we'll give a few minutes. Some people are still coming in, and then we'll get started, okay? Dr. Pastor, welcome. Got you on, you're still muted.
Don't know if I've been able to meet with this many athletes at one time. This is great.
I think that some teachers would like this turnout, you know, and
yeah,
with their classes, you know.
That's right.
And I just saw and spoke to several other athletic trainers with the Sun Belt that if you are fully vaccinated, there are no need to test. The Sun Belt has pushed forward with those guidelines, and following the CDC recommendations, it seems. So that's interesting and exciting to see. So,
right. Yeah, there's so many reasons why you should get vaccinated, and we'll cover some of those.
Okay.
Here today, once we get everybody.
It's 12 o'clock, so we're going to get started, guys. Welcome. My name is David Strickland. I'm the head athletic trainer here, and Dr. Randy Pastor is one of our team physicians. He's also the director of student health services here at UCA, and he's been instrumental in putting forth and assisting us with our policy procedures, with the mitigation and the testing and protocols for UCA. So I know many of you know Dr. Pastor, and thank you, Dr. Pastor, for being here. And one of the reasons why, we wanted to do this is because there were some questions, and I think very good questions amongst the student athletes on, what about the vaccine? Is it good? Is it right for me? And I know some of you have some very good questions. And so we wanted to do this educational session. As many of you know, that we are having a full vaccination for everyone, free of charge. This is going to be Wednesday. You will have certain times for your sport to be there, but Dr. Pastor and his group are going to be there Wednesday. I think they're scheduled from 6 a.m. till 8 or 8:30, something like that, Dr. Pastor. But they're going to be there set up at 6 a.m. ready to go. And many of you already have COVID testing to do that Wednesday. Some of you don't, but you have a time scheduled for your sport to come to get vaccinated. And I think this is wonderful. And I got to thank Conway Regional for helping us with that as well. They've been instrumental in helping us with all this, pushing forward with the testing. But we wanted to have this educational session for you guys to have today, so that hopefully this will help you make an educated decision. Okay, so I'm going to turn the floor over to Dr. Pastor, and we do have this recorded, and I'll be sending it to your coaches. And that way, some of you that there are some folks that can't be here today. And
hey, Dave, just real fast. We do, and Dr. Pastor, we are going to record this. And I know there's other sports and athletes on here and coaches, but we are at capacity of the meeting. So we've got that have tried to jump on, that we're going to have this recorded and have it sent to them as well, because they're not able to get in.
Oh, yeah, shoot. Okay.
Wow. Okay. Well, that's why we topped out at 100. Okay. I want to say a couple of things. This is a very exciting time in this pandemic, because we finally have this virus in our rearview mirror. And if we will do our part and get vaccinated, this thing is going to be long gone by the time we come back in the fall. It'll be largely a thing in the past. So I want to tell you about the vaccine. First of all, the vaccine that we will have on Wednesday is the Pfizer vaccine. It is the messenger RNA vaccine, and we will be there from 6 a.m. until 10 a.m. actually, because we're going to be doing the band, cheer, and dance also after athletics. You all do your testing between 6 and 8. So if for some reason you have to leave and come back, or something happens and you do want to come back, we'll be there till 10. First of all, we've given out 140 million doses already in the United States. That's 28% of the population has been vaccinated. We've had 0 deaths. We've had 0 severe reactions. you might have heard early on, there was a chance of what's called an anaphylactic reaction, where you can some people who get stung by a bee, they can swell up, their throat swells, they get hives, they start wheezing. That's called anaphylaxis. That happens all the time. Snake bites, bee stings, peanut allergies. And so we know now if we give a epinephrine, we reverse it very quickly. I've treated a lot of anaphylaxis here in my clinic. I hadn't lost a single person in 14 years. So we're very comfortable with treating anaphylaxis if it does happen, but the percentage out of the 140 million doses is 0.00024% of those who have. Only 10 out of 140 million people have even had an anaphylactic reaction. So that should not be a concern. If you are one of those people who had it, I will be there with the epinephrine and I will administer it to you and you would be fine. Number two, the technology, this messenger RNA technology. I've heard a lot of people saying, well, how do we know it's safe? I'm just concerned that we developed it too quickly. But let me tell you, do you know where we learned messenger RNA technology? We stole it from the virus. Any one of you who have ever had any virus, if you've ever had a cold, if you ever had the flu, if you ever had a respiratory virus, any virus you ever had was a virus that injected messenger RNA into your cells and caused your cells to reproduce itself over and over and over again. That's what messenger RNA technology is. We stole it from the virus. We looked back in the 1970s and said, hey, if the virus can do this, why can't we do it? And we've had this technology around since the late 1970s, but it was very expensive to develop it. We knew how it worked, but how do you get it to put it into a shot and be able to distribute it? And nobody wanted to take the chance because it would be $1 billion endeavor for a company to do it. And so nobody did it. Well, when the pandemic came around and federal government starts approving $1 trillion budgets, there was plenty of money to throw at developing this vaccine. And all this vaccine does is do exactly what a virus does to you, except rather than injecting the information on making the entire virus, which can infect you, this messenger RNA vaccine only injects in the code that tells your cell how to make the spike on the surface of the virus. So as your cell now is making the spike, the rest of your body is coming along, recognizing it, making antibodies to the spikes, so that when you get exposed down the road to the virus, you've got antibodies to the spikes and you kill that virus as quick as it enters your body. So this is an extremely safe technology, been around for thousands of years. It's nothing new. It's new that mankind has been able to replicate it. That part's new, but the technology is old as time. The third thing I want to say is, why should you get the virus? Why should you get the vaccine? First of all, from a medical standpoint, I would say do your part. As a member of the human race, as an American, do your part, get the vaccine, and let's stamp this thing out. If we could get 70 to 80% of Americans to get this vaccine, this pandemic is gone. So just from a medical standpoint, why not do your part? I did my part. I tested positive for the virus back in October, and I still got vaccinated twice. I did my part. Number two, do it for your team. I have never seen teams work harder than I saw your teams this year to do everything you could to create a bubble. That was hard work. And then you had to compete. I'm preaching to the choir. You all can tell me because you went through it and the coaches had to go through it. I watched it and I can tell you there was a lot of hard work. You all worked hard for your team. Well, if you take this vaccine for your team, then you're not going to have to worry about quarantining down the road. If you ever get exposed again, you're not going to have to sit out for a week or two. You're not going to have to quarantine. You're not potentially going to catch the virus, bring it into the bubble, and expose your team. If you're vaccinated and you have 3 or 4 days off and you want to go see your family and you've been fully vaccinated, you're going to be much more at liberty to go see your family and don't worry about coming back into the bubble and taking down your team. So it will definitely make your team a lot safer and not have to work near as hard the next season to keep COVID away from your teammates. So I just want you to understand that if you are fully vaccinated and you come in contact with the virus, you don't have to quarantine again. You just go right back on the playing field. You go out there like you always have. Nothing changes. The last thing I want to say about it is there is a big push from the current White House administration. Within the Biden administration, they are pushing very hard to create what's called a vaccine passport. I don't know politically if they'll get enough traction. Who knows the way politics is, but I can tell you they are pushing really hard to give everybody a vaccination passport, is what they call it, that will let you into concerts, sporting events, cruise ships, airlines. And they're actually getting a lot of the airlines and cruise ships are pushing and asking the federal government to create this vaccine passport, because that way it takes the liability off of them. So the airlines want it, cruise ships want it, sporting events want it. I could see a form of a vaccine passport developing, and if you've been vaccinated, that's going to be your ticket into all these things. So that's my spiel on why you should get it, and I'm going to answer questions. And I guess maybe David in the chat, if you want to keep up with that.
Yeah, no chat yet, but so please, if you have, let's try to keep it orderly, but please, if you have any questions with Dr. Pastor, I'll try to keep up with chat too. You can throw some questions in chat. I'll definitely do that as well. Okay.
I had my 92-year-old father, my 86-year-old mother vaccinated. They did just fine. I had my daughter, my wife, my kids, all vaccinated. They did just fine. I had the virus, vaccinated, did just fine. So the point I'm making is, if I didn't think it was safe, I wouldn't have given it to all my family.
Yeah. So there's a question: what's the deal with the different types of vaccines, and why are there different kinds?
Yeah. So the first two that came out, Pfizer and Moderna, they are the strict messenger RNA vaccines. They require 2 doses. And then the third one that came out, the Johnson & Johnson, some people refer to as the JJ. Yeah. It only requires 1 vaccination. So it's more popular, but it's not quite as effective as the first 2. The JJ, Johnson & Johnson's technology is a little different. It still uses, it still utilizes the messenger RNA technology, but it came from a different slant, and its delivery system is a little different. They're all equally as safe, and I would get whichever one you can get. I don't know if that answers your question.
Yeah. What are the side effects affecting most people?
Yeah, so it's kind of a roll of the dice. Some people get a sore arm. Some people get a little body aches for 8 to 12 hours. I can't find a rhyme or reason. I've seen people who are immunocompromised and overweight have nothing, not a symptom. And I've seen fit, healthy, young people say their arms ached and they felt a headache for 12 hours after the second vaccine. Yeah. But I would say worst case scenario, you'll feel like maybe you have a light case of the flu. The good thing is it's lasting very short. It's 6 hours, 8 hours, maybe 12 maximum. Okay.
So if I've had if I've tested positive within the last 30 days, 90 days, am I okay to get the vaccine? Is there a risk? Am I going to get sick if I get the vaccine? It is such close time to my positive test.
So the recommendation is if you've had COVID-19 or tested positive or had the illness, as long as you've gone beyond your 10 days of recovery and you're not feeling acutely ill, then you're fine to take the vaccine. So if you're 2 weeks out and you are asymptomatic, I would still get it. And the reason I would get it is not so much maybe because you need it right now, but once you've been vaccinated, you're going to have that vaccination passport. You're going to have that waiver. You're not going to have to test anymore. You're not going to have to quarantine anymore. That's going to buy you a lot of liberty if you've had the full vaccination, been fully vaccinated. So as long as, even if you had it, COVID-19, as long as you're asymptomatic, feeling good now, I would still go ahead and get it.
Okay.
I did. That's what I did.
How long does the protection from the COVID vaccine last? How long are we thinking that this vaccine is going to last?
Okay. So most of the experts say we think it's going to last about a year and probably need a booster once a year, like a flu vaccine. They're talking about mixing it in with the flu vaccine. So that's still down the road another 6 months. But we know now that we know for sure at 6 months, your antibody level is as good at 6 months as it was shortly after your second dose.
Okay.
So we know it's at least 6 months. And that's why the CDC removed the 3-month clause. It used to be that if you were vaccinated and you were exposed to COVID-19, if you were exposed to a case, you only had a waiver for 3 months. Now that we've been 6 months out, the antibody level is just as high at 6 months. The CDC removed the 3-month time frame. So now it's unlimited.
Okay.
We think it's going to last about a year.
Okay. Okay. There's a question. We're going to have a lot of teams coming in for the vaccine Wednesday, but they're coming in at staggered times. I'm just talking to this individual that asked this. The teams are kind of coming in at staggered times. But Dr. Pastor, the question is how many people are you going to have there to give the vaccine Wednesday morning?
So we're going to have a crew there that can do about 180 an hour.
Yeah.
So that should be able to handle the volume.
Yeah. Yeah. Absolutely. Okay. When will the second dose be given? Kind of what's the time frame? If somebody's looking 2 weeks from now and they're like, gosh, I'm not in town 2 weeks from now, what's the leeway there on getting the second dose?
Okay, so we are going to schedule a repeat clinic for 3 weeks from this Wednesday.
Okay.
21 days out. We're going to have another mass clinic where you can come and do it all over again the second time. If you miss that, you can go to Conway Regional. We will give you the link that you can go to Conway Regional and you can get your second dose anywhere between day 17 and 6 weeks after your first dose. So anywhere between on day 17 all the way up to 6 weeks out, you can get your second dose, and we'll give you a link. You can get it at Conway Regional if you miss our second clinic.
Okay. Okay. Does vaccine cause infertility in women?
Absolutely not. That was a fallacy. That was extremely a speculation. Somebody who was just looking to, I don't want to get into the details, but I can just assure you I have studied this in great detail because I have young daughters who just had my first grandchild and I want more grandkids. And so I did thorough investigation, and I promise you that it absolutely does not cause infertility.
Okay. Okay. If I'm not able to make it on Wednesday, is there another time I could come for the athlete? I can tell you that we're trying to do a mass vaccination on Wednesday for all the athletes, but if by chance they did miss that, Dr. Pastor, how would we handle it?
Yeah, so we would just give you the link. I can maybe forward that to you, David, and send it out to the coaches. And you would have to go to Conway Regional to get it, or you can get it at other local pharmacies in town.
Okay.
But I can tell you the Conway Regional route is extremely efficient. You're in and out of there in 20 to 30 minutes.
And I think that we did that initially before this came about. I think the coaches had that initial link, and some of you may have already received that from your coaches where they sent that link out initially, because we did get that invite to go ahead and get it done at Conway Regional. So you'd probably just need to go back to that route. We were just trying to make it a heck of a lot more convenient for everybody by bringing it to you.
Right. At the same time you're testing, you just leave the testing table, walk over there to the other table, get your shot, you're out the door. Now, I can tell you, you do have to wait 10 to 15 minutes after the injection. You'll have to just linger there in the Pepsi Center, just in case, there's any issues. I'll be there, and we'll have a nurse practitioner there to check you and talk to you and make sure you're okay. But you have to stay in about 10 to 15 minutes after the shot before you can go.
Yeah, that's just to make sure you're okay. You don't have any problems there, and that's the case whether you do it here with us on Wednesday or whether you go to Conway Regional. They're gonna have you stay for a little bit and hang out with them just to make sure that you're not having any adverse effects. Let's see. We had problems. Let me see here. If we get the vaccine, does that mean we still have to take weekly COVID tests? So go ahead, Dr. Pastor.
Well, the CDC says you don't have to take weekly COVID tests. In fact, they say don't get tested routinely after you've been vaccinated.
Yeah.
Now, David can address what the NCAA is currently saying.
Yeah, so the Sun Belt is one of the conferences that have just recently come out with the guidelines on if you are fully vaccinated, that you can hang around, you can be with other student athletes without your mask, without worrying about being social distance, and those are CDC guidelines, and back to normal. If you're fully vaccinated, you do not have to be COVID tested. So obviously there is a push. I'm sure some of you saw that Rutgers is requiring vaccination to attend in-person classes. So I don't, I haven't seen other conferences and institutions moving to any other mandates or anything like that. But I can tell you that Sunbelt has moved in that direction, that if we're starting to see some of those, back to normalcy, if you will, if you're fully vaccinated,
I think moving forward, as we see that this vaccine is far more effective than we ever hoped for. And so all the data that continues to come out about this vaccine is overwhelmingly positive. And so I only see things getting better and better for vaccinated people. I think there'll be less restrictions. You won't have to have testing. I can see you being able to travel on the bus without wearing your masks. I can see all this coming down the road over the next several months if you're vaccinated.
Yeah. Carly, ask your question there. I'm just trying to understand your question. If you, for your Conway Regional question there, Carly Whittington, if you can, maybe you can clarify your question.
Okay, yes. So we did our appointments through the Conway Regional online thing before we knew about the mass vaccine thing. And when we called to cancel, they said that they never had our appointments in the first place. So I just want to make sure that that doesn't happen again, for our second one, because I know that we'll be at conference.
Okay. Well, they are handling a very large amount of requests online. I can tell you this about Conway Regional. They don't check to see if you have an appointment. That is just to try to space people out so that people don't all come at the same time. But they aren't looking online to see when your appointment was. If you show up and say, I have an appointment and I am phase 1C, they're not even checking. They're not asking you to show proof of that. They're just saying, go on back. Yeah. So I can tell you, if you would have showed up, they would have just said, go on back and get vaccinated.
Okay, thank you.
Sure.
Dr. Pastor, which vaccine is it that we're giving at the indoor facility on Wednesday?
So this will be the Pfizer vaccine.
Pfizer vaccine.
Very similar to the Moderna.
Okay.
Both messenger RNA.
Okay. Oh, very good. Any further questions, anybody? There's some wonderful questions. Some great questions.
Very good. Very good.
Yeah. And I hope that they've helped. Any further questions for Dr. Pastor? Or Dr. Pastor, anything else?
I was just going to say, I can guarantee your coach is really hoping that you'll get vaccinated, because they don't want to be going into a game or a match and all of a sudden they lose several of their players because you didn't get vaccinated and you got exposed, and my contact tracing team called you up and said, guess what? You're in jail for 7 days. And the coach is just pulling his hair out. So listen, if you want to win championships, do it for your team. Do it for your team.
Yeah. Thank you, Dr. Pastor, and everybody here. Thank you for showing up, and with some wonderful questions. I hate that there's some people that did not get in who would have known that we would have filled this sucker up, but I'm glad we were able to get some good questions answered, hopefully. But I appreciate you, Dr. Pastor, for coming forward with us, and hopefully this has given you, the student athletes, some good information to help you make an educated decision. Okay. So again, thanks everyone for being here, and appreciate it. And I will say this, I'm sure Dr. Pastor knows this, that if you do have any further questions, feel free to contact Dr. Pastor. I'm sure he's more than happy to visit with you. He's come and talked to other sports and stuff, but if you have any further questions, or contact any of your athletic trainers, and we will get those questions answered for you. Okay. So again, thanks everyone for being here, and Dr. Pastor, thank you as well. Okay.
Thank you. Thank you.
All right. Bye-bye, everybody.
Day.